Today, we're diving into a medical detective story that's happening right inside our own bodies. The clues? They're these tiny, faint electrical signals. The crime scene? Your nervous system. And the suspects? Well, they're the very nerves that are supposed to be on your side. Let's get into it.
You know, if you've ever woken up and your hands are all tingly and numb, or you felt that sharp shooting pain down your leg, or maybe a doctor just told you you've got a pinched nerve, then you've been right at the scene of the crime. These are basically distress calls from your body's wiring, and figuring them out, well, that can be really, really tricky.
So to solve these kinds of cases, doctors have two totally different ways of thinking about it. Picture this. It's a showdown. In one corner, you've got the old school detective, right? The one who gets up close, listens really carefully, and tries to get a confession. And in the other corner, you have the high-tech surveillance expert, the one using all these powerful cameras to get this big bird's-eye view of the whole scene.
Okay, let's meet our contenders. In this corner, the detective, it's called electrodiagnosis, or EDEX for short. This is the classic method. It uses these tiny signals to listen directly to what your nerves and muscles are saying. It's kind of like an interrogation, you know? It gets a direct confession about whether they're working right. And in the other corner, the surveillance expert. That's advanced imaging, like an MRI or an ultrasound. These tools don't listen, they look. They create this super detailed map of the crime scene to show if a nerve is being physically squeezed or damaged.
So, where did these two experts even come from? To really get how they work together today, you gotta look back at where they started.
You know, this idea of listening to our body's electricity, it's not new at all. It actually started with some really early experiments way back in the 1800s. By 1929, we had the first needle EMG, and by the 1950s, nerve conduction studies were being used all the time. These are the tools of our old-school detective, and they've been sharpened for over a century. On the other hand, the high-tech imaging tools, the super high-res MRI and ultrasound, they're basically the new kids on the block. They've only really taken off here in the 21st century.
All right, let's get to our first case. We're talking about reticulopathy. You probably know it as a pinched nerve in your neck or your back. And as you're about to see, this one is a huge puzzle for both of our experts.
So this is where our high-tech surveillance expert, the MRI, starts to get into a bit of trouble. I mean, an MRI gives you this unbelievably detailed picture of the spine, right? But that's the problem. Get this. Studies show that pretty much 100% of people over 60 who have zero pain still have abnormalities on their spine MRI. It's like the surveillance camera sees potential crime scenes everywhere, even when no crime was ever committed. And that creates a huge problem. Imaging is awesome at seeing the structural stuff, the what, but it often can't tell you if that thing it sees is actually what's causing your pain. Now, our detective, EMGX, is way more specific. It can confirm if a nerve is actually misfiring, but its weakness? It can totally miss problems that are purely sensory. So here's the bottom line. Imaging can see way too much, and sometimes EMGX can see too little.
So for a pinched nerve, there's no knockout punch. It's a draw. The best move is to get the detective and the surveillance expert to work the case together. The source material is clear on this. You combine them when things are confusing, and especially when you're talking about something as serious as surgery.
Okay, let's move on to our second case, because here the roles of our two experts get a whole lot clearer. We're looking at carpal tunnel syndrome, one of the most common nerve problems out there. When it comes to carpal tunnel, our two experts are the perfect team. Our detective, EDX, is the absolute gold standard for figuring out severity. It can tell you with incredible accuracy if your carpal tunnel is mild, moderate, or severe. It answers the question, how bad is it? Our surveillance expert, using ultrasound, answers a totally different question. Why is the nerve being squeezed? It can spot the physical cause, like a cyst or a problem with a tendon, so it tells you, why is this happening? But this is where a really thorough investigation becomes absolutely critical. And it's about so much more than just a sore wrist. There is a surprising, and honestly a potentially life-saving connection between your carpal tunnel and your heart. That connection is a really serious disease called amyloidosis. It's where these abnormal proteins build up in your organs, especially your heart. And here's the mind-blowing part. For some people, carpal tunnel syndrome is the very first warning sign. It can show up years before any heart problems start. So a proper diagnosis isn't just about your wrist. It could be an early warning sign for a life-threatening condition. So who should really be on the lookout for this? Well, doctors are now being told to screen for amyloidosis in carpal tunnel patients who fit a certain profile.
We're talking about men over 49 or women over 59, people who have it in both hands, or if you have a history of things like spinal stenosis or heart issues. It's a perfect example of why this detective work has to go way beyond the most obvious clues. All right, for our final case, the stakes get even higher. We're not talking about a local problem anymore. We're talking about a widespread attack on the entire nervous system. We're talking about a condition called CIDP. Okay, don't let that name scare you. Let's just break it down. CIDP is this rare disorder where your body's own immune system starts attacking the protective coating around your nerves. And when that happens, you get progressive weakness and sensory problems in your arms and legs. It's a really serious condition, and you absolutely need a definitive diagnosis. Now, when it comes to diagnosing CIDP, there is zero guesswork. The official guidelines from 2021 are crystal clear. To confirm a diagnosis, your clinical findings and your electrodiagnostic criteria, that's our detective's work, must be met. It's not optional, it's the required standard of care. So, in this final round, we have a clear winner. Electrodiagnosis is the primary tool. It's required by the guidelines, plain and simple, because it's the only test that can really tell if the nerve damage is demyelinating, which is the hallmark of CIDP. Imaging, it plays a supporting role. Sure, it can show if nerves are enlarged, which helps, but it's mainly used in weird cases to make sure nothing else is being missed. For this puzzle, the old school detective is the one who cracks the case. So, after watching our experts go head-to-head with a pinched nerve, a squeezed nerve, and a massive, widespread attack, what's the final verdict? What's the call in this showdown between old tools and new tricks? And the verdict is really clear. It was never a knockout. The high-tech challenger hasn't come in and replaced the veteran champion. No, what's happened is they formed this incredibly powerful diagnostic team. They're not rivals at all, they're partners. And together, they are so much stronger. So this is basically the modern playbook for figuring out nerve problems, and it all boils down to one simple idea: form versus function. You use electrodiagnosis, our detective, to understand function. How bad is the damage? Is the nerve's wiring just frayed or is it totally cut? Then you use imaging, our surveillance expert, to understand form. What is physically causing the problem, and where exactly does a surgeon need to go? It's all about using the right tool to answer the right question. And that leaves us with one last thing to think about: our ability to see our body's structures. It's getting more and more powerful every single year. But what we've seen today is that what a nerve looks like and what a nerve actually does can be two completely different things. So as our technology gets smarter and smarter, the real question is, will solving our body's toughest puzzles always need a detective who knows how to listen for the truth?